Good day. My name is Sonia Mboho. I'm going to represent to you Unit 8, which is about roles and responsibilities of the registered nurse. In my presentations, I'm going to share the screen with you. So you can see. So in my presentations, I'm going to answer these 5 questions. The first one being discussing the recent changes and their impact on the roles and responsibilities of a registered nurse. Nowadays, nurses are respected professionals. They are qualified through university. They are no longer qualified through hospitals like before. Before, they used to be trained in hospitals. Now they are being trained in the university. Since 2018, all nurses are required to obtain a degree level credential for them to practice. Some nurses opt to specialize their profession by adding a master's degree to their first nursing degree. There are growing demands placed on healthcare services, and this has had an impact on nursing duties. As people are now living longer than before, this has brought more pressure on the health budget and staff because healthcare is very expensive and time-consuming. The Healthcare Act started with giving nurses leadership in specialist roles such as managing a care plan, monitoring diets, tracking progress, recording vital statistics, and administering medication. Nurses were also given powers such as the capacity to prescribe medication for patients, which gave them more control over the care of their patients, and freedom to work more freely. The impact of the economic changes will always affect the nursing professionals. Since the financial crisis of 2008, the healthcare budget has been lowered to keep government spending in check. This has resulted in growing expenses, supply problems of equipment, technology advancement, and greater public demand. Since the NHS operates on a limited budget, some patients may not be able to receive the treatment they need. Technology changes has also an impact recently on nurses. As technology develops, so do the tools and systems that nurses and other health workers use. Though new tools and systems can benefit patient care because they make it much easier for nurses to access the past medical records and referrals of their patients. Now I'm going to discuss the role of the nursing and midwifery council in relationship with the nursing. Nursing and Midwifery Council is responsible for the education of nurses across the United Kingdom. It is responsible for shaping the content and design of the programs offered, as well as stating what should be understood by registered nurses or midwives. It approves institutions of higher learning to offer medical programs. Currently, it has accredited about 1,000 programs in over 70 education institutions in the country. It is also responsible for the registration of nurses and midwives. The NMC sets standards for practice and behavior, which must be adhered to by all nurses and midwives. After completing programs successfully from the institutions, the institution informs the NMC that the learners have achieved education and practice, standards needed, and way of good character and practice. They are then eligible to apply to be part of the register. The NMC manages complaints about nurses and midwives. NMC can restrict or remove midwives or nurses' practice from their register. NMC are responsible for revalidation through developing and implementing a system. And this system is what every nurse or midwife in the country has to go through to continue being part of the NMC register. The professionals are required to renew their registration every 3 years, as well as confirm they are ready to meet the principles of the code. Now I'm going to analyze the code of nursing practice and the role of a registered nurse. The Nursing Midwifery Council Code has 4 different main sections based on the nursing professional values, and these are promoting professionalism and trust, 2, preserve safety, 3, practice effective, and 4, prioritize people. Prioritizing people means that a registered nurse must be put in the interest of the patients first, to treat the patients professionally and ethically in maintaining their dignity, as well as ensuring that their needs are identified, assessed, and managed as necessary. Treat the service users with respect, as it is a necessity for the care process and upholding the rights of the patient. The registered nurse should not be disrespectful, judgmentally, or discriminatory to patients regardless of the patient's behavior or personal view. Practice effective, which is the second one, means the ability to practice based on several factors, which includes the ability to adhere to the evidence base, advise on treatment, interpret results of the test, and assess the patient's needs. Provide the best care within the shortest time possible, while sharing information with the patient, as well maintaining standards of professional knowledge and management of records. The third one, preserving safety, which means that the registered nurse should be involved in all decision-making and ensuring the safety of patients. They should understand when they are out of depth and when they need to help to deliver patients' care. Understand their skill set and limitations, because if they try to manage patients doubtfully or lack the necessary knowledge or skill, it will show the care is not safe. Nurses should understand the process of others, the care process of others, and be alert to the probability of the lapse in self-care, which may lead to adverse effects on the well-being of the patients. Finally, they should be able to identify unsafe and safe practices, as well as to be confident to report and address safety concerns promptly. Then the last one is there to promote professionalism and trust, which means that a registered nurse should defend the reputation of nursing and uphold professional values. Adapt all the necessary attitudes and behavior outlined in the NMC and act as role models by ensuring professionalism in their daily practice. Patients have trust in nurses. If patients have trust in nurses and will trust their abilities, then I'm going to talk about the need for effective communication in the multidisciplinary team setting. Communication skill is the most important for a nurse to process and practice. Multidisciplinary teams is made up of experts from many different fields who collaborate and pool resources to provide comprehensive patient-centered treatment. So by that, effective communication is needed. Multidisciplinary teams are required to communicate clearly, listen and respond while supporting individual needs and rights of the patients. This means communicating in a way which can be understood, be it verbally or body language or non-verbal. It must meet the language needs of the patient and their family and be culturally sensitive all the time. Effective communication helps in showing personal leadership, motivating others, and resolving conflicts within the multidisciplinary teams. It facilitates the two-way exchange of information. This is important in ensuring accurate diagnosis and interpreting of symptoms, and then comprehensively sharing the information within the multidisciplinary teams. Communication helps the team to engage in care planning and decision-making. This is by reaching agreement on plans and problems, facilitating self-management, recognizing that the person receiving care has an important role in co-producing their care and ensuring that decisions are appropriate, realistic, and reflects the person's preferences and goals for their care. All this is said to lead to improved outcomes, enabling a better understanding of their care plan and treatment and improving adherence to treatment and care. Increased ability of a person to self-manage their care, ensuring critical information is not lost when care is transferred, like in a handover situation between the teams, and ensuring new information is considered and communicated. Above all, communication leads to improved health outcomes, matching care and treatment to the patient's care needs, good satisfaction and experience with health service, and reducing patients' distress, which may arise from the care. Now I'm going to evaluate the effectiveness of disciplinary approach in health settings. Multidisciplinary teams are fantastic for patients' outcome for many reasons. For example, cross-fertilization or ideas, professional knowledge, and expertise can be shared and facilitated. All these contribute to meeting the holistic needs of the patient. Healthcare settings require many different care and medical disciplines to work together. Communication skill is important, in particular, all staff to be their best, as without this, the team may not work well together and may not achieve the needs of the patients. Agreed approach is when everyone works within their own scope of practice. It is the key to successful teamwork in a multidisciplinary team. Each member must be committed to support the team and cooperate with mutual respect. There should be an agreed framework and focused goal and review of progress towards the goal they are focused on. The team should have the coordinator responsible for overseeing the treatment plan for the patient. And then the role of a nurse in a multidisciplinary team is more than just caring for the patient. Registered nurses use different tools to work in partnership with the patient, making the patient central to the care they receive. The success of the nursing process depends on the quality of the relationship between the nurse and the patient, but is thought to achieve effective interventions and positive patient outcomes overall. Registered nurses have a duty for patient holistic care, which consists of cultural, spiritual, and psychosocial needs. As patients are priority to nurses, nurses need to advocate for the patient's best interest and maintain their dignity through pure care and treatment. This can be through giving recommendations in the patient's treatment plan, since when the patient is unwell, they are unable to understand medical situations, and during this time, nurses support them and represent their best interests at all times. Nurses are directly involved in the process of making decisions for patients. Treatment and should never make mistakes, as it can affect the patient. But if it may happen they made a mistake, it must be reported immediately, so the solution might be found while it's still early. They think critically when assessing the signs of the patient to identify the potential challenges to take appropriate actions and recommendations. Those are the roles of a nurse. Then in summary, in this presentation, we have discussed the recent changes and their impact, roles, and responsibility of the registered nurse. Discussed the role of the Nursing and Midwifery Council in relation to nursing practice, analyzed the implications of the Code on Nursing Practice and the role of the registered nurse, explained the need for effective communication in a multidisciplinary healthcare settings, and finally evaluated the effectiveness of disciplinary approach. Thank you for listening to my presentation.